Whipple's disease, it is a chronic long-term infection which is caused by Trophirema whipple, which is a gram-positive bacilli. So it proliferates in the macrophages. Remember this word, macrophages. So this bacilli proliferates in the macrophages. So macrophages are affected here. It also inhibits the phagolysosome formation. So thereby macrophages cannot ingest this bacilli because it is inhibiting the phagolysosome process, and also inhibits the function of the macrophages, which is usually antigen presentation to the antibody, that is also inhibited, so there will be minimum immune response. So it is seen in 40 to 60-year-old Caucasian man who is a European man with the white skin, and you can see the scan symptoms. What are CAN symptoms? You can see this cardiac symptoms, arthralgia, and neurological symptoms. Cardiac symptoms and arthralgia is usually migrating type of arthralgia involving the large joints, and neurological symptoms like dementia and encephalopathy can be seen. Apart from the scan symptoms, you can also see gastric symptoms, which is very important. Here you can see steatorrhea and diarrhea, abdominal cramps also seen. The reason for steatorrhea or fat malabsorption is due to densely packed macrophages. So we have already said, right, this bacteria is proliferating in the macrophages. That means the macrophages increase in the number. So in the villi you can see accumulation of macrophages. So this obstructs the lymphatic drainage, or which blocks the lymphatic drainage. That's why there is fat malabsorption. And diagnosis is by PAS stain, which is positive in the macrophages, and also in out of macrophages also it is positive. So here you can see the characteristic feature, which is the foamy macrophages are seen in the intestinal lamina propria. Remember this, foamy macrophages are seen, and this bacilli is present outside the macrophages also. It indicates active infection or the recurrence. And apart from this past and positive seen in macrophages, it is shown by our Whipple's disease, and second, it is also shown by Mycobacterium avium, which is a extrapulmonary TB causing agent, I guess. So this Mycobacterium avium also shows PAS positive macrophages. And coming to the intestinal biopsy, if you take in a case of Whipple's disease patient, it shows diffused specific lesions, and treatment give antibiotic therapy for greater than 12 months. So here is a picture of foamy macrophages seen in Whipple's disease. These foamy macrophages are PAS stain positive, and here are the symptoms of Whipple's disease. You can see CAN symptoms, which include encephalopathy, that means neurological symptoms, encephalopathy, dementia, arthralgia, polyarthritis, which is migrating type, steatorrhea, diarrhea, lymphadenopathy. These are the symptoms which can be seen in Whipple's disease.